Once a year, we hold the SaferX Awards to recognize the leadership of the top 10 states in e-prescribing and celebrate their successes. And e-prescribing has indeed come a very long way. From those early days, in the early part of this decade, when we had only a few prescriptions processed electronically, to this year, when prescribers, pharmacies, and payers will transmit approximately 2 billion electronic prescription messages. We have connected over 55,000 pharmacies to 200,000 physicians, the majority of the nation's payers, and over 200 software companies. The result is a national highway for healthcare. I applaud all the many people who have helped make e-prescribing a reality. Many of you are in this room today, from the PBMs and the pharmacies to the physicians, the payers, software vendors, state medical associations, national and state pharmacy associations, national healthcare IT advocacy groups, regional healthcare IT collaboratives, researchers, analysts, and a host of NGOs. And equally, we thank the federal government that have provided the policy, the vision, and the incentives to make e-prescribing a reality. I'm very privileged today, and we're all very privileged to have for us our keynote speaker, Dr. David Blumenthal, join us.
It's a pleasure to be here. It's a pleasure to be part of the recognition of these 10 states who are pioneering and leading on a very important contribution to the health and welfare of Americans. I also want to congratulate Surescripts and Harry Tortonis for their leadership. It is the private sector that is moving this work forward. The federal government is a catalyst. We can help correct market failures. We can help make the playing field more hospitable for the private sector. But it is thousands upon thousands of providers and thousands of companies and community leaders, insurance companies, and businesses outside of the health sector who are making it possible for communities to lift themselves up on every dimension of healthcare. We did some work in my own research group at the Mass General Hospital before I left, documenting the cost reductions associated with electronic prescribing. So I know and have seen through my own group's work the potential impact in well-done scientific studies of electronic prescribing. We've also, of course, included e-prescribing in many ways within the meaningful use framework. And there are two areas that I think really deserve much more attention in the second stage of meaningful use. And one of them is the area of health information exchange. So I think that the provider community and the vendor community should look forward to a much more robust set of requirements around health information exchange. Again, we want information to follow patients. Again, want to congratulate both the states, the congressional delegations, and Surescripts for their role in making all this possible. Thanks again.
And now for the next part and the last part of our event, which is to recognize the top 10 states for e-prescribing. And number 10 coming in is Florida. Number 9 is Indiana. Number 8 is Hawaii. Number 7 is Pennsylvania. Number 6 is Connecticut. Number 5 is North Carolina. Number 4, Delaware. Number 3 is Rhode Island. Number 2 is Michigan. And now for the number 1 for electronic prescribing, Massachusetts. Thank you for all the states and for all the people who participated today. All the great work that has been done by all the people who are represented in this room that has made e-prescribing happen. Thank you very much, and we hope to see you next year.